Hi, folks. Let's talk about sciatica. If you've got that pain radiating down the back of your leg, then it could be that your sciatic nerve is irritated. Now, I'm not a doctor and this is not medical advice, but I do know that when it comes to nerves, that our muscles actually have a job to do. They keep the bones and the joints and the nerves both protected and moving like they should. So if you've got a nerve problem, you may be able to trace it back to a muscle problem, like maybe a muscle or some muscles are too tight or too weak and inactive. So the good news is that you can work with your muscles and get them moving and firing around those bones and the joints and the nerves. And the better news is that you can find exactly which muscles haven't been moving and which ones haven't been firing with a pretty simple process. I'll show you a quick example. Take your hand and open your fingers enough to where you don't feel anything, like no stretch at all. That's your baseline, okay? Now, spread your fingers a little bit wider so you do feel little stretches throughout your fingers, okay? Now, relax the muscles. That's a new stretch feeling, okay? Do it again just for clarity. Start with your baseline and then open your fingers a little bit more until your brain recognizes stretches, and then relax the fingers again. So at that moment of a stretch feeling, do you think that you're getting maybe some new range of motion in the muscles? Also, in order to reach that feeling, do you think that maybe you're firing a muscle in a new way that hasn't been activated that way lately? You've got it active now just because you felt a stretch. Now, another question. Do you think that already you might have better blood circulation in the muscles around your hand? So now imagine replicating that process throughout your whole body, setting a baseline, looking for some stretch feelings, getting your brain interested, and then relaxing them again. Imagine doing that for your whole body, especially the muscles in your back and the muscles in the backs of your legs. Getting that activation, that range of motion, that blood circulation, that brain connection. Do you think that that would help you? Well, if so, then we can get started right now. This is part of a longer class that I teach called the Electric Stretch, and you can find us at backtoflexibility.com. So stand up, toes and heels touching each other. You can do this sitting down if you need to. And let's get a baseline. Pull your stomach in tight and hold it tight and reach forward, just to where you don't feel anything. And we're not trying to get to a particular distance here. We're just going to where we feel like, okay, anymore, I would not feel okay. All right, that's your baseline. Keep your stomach in as you come back up. Let's start with a breathing exercise. Toes and heels touching each other. Bring your hands under your chin, knuckles touching your chin. Breathe in by your nose as you bring your elbows up. Now keep your elbows high enough to where you feel some stretches in your ribs, okay? Throughout this whole thing, breathe normally. It's easy for me to breathe normally because I'm talking and I have to, but you just keep remembering this is normal, easy breathing the whole time. Get to where you feel this in your ribs and contract the muscles in your left leg. Don't move them, just squeeze them. And then release. Now the right leg. Squeeze and release. Now both legs. Squeeze and release. Now forget the legs. Again, easy breathing. Take a breath if you need to. Pull your stomach muscles all the way up and then let them go. Pull them all the way back and then let them go. Pull them all the way up. Now hold your abdominals in. Take a huge inhale so your rib cage expands. And as you exhale, squeeze your left arm and fingers and then release. Right arm and fingers. And look for some of those little stretch feelings. Now squeeze both arms and then release them. Head up, elbows forward and touch, palms together. Push your knuckles into your chin until you feel it in your throat. Again, take some easy breaths here. Find where your throat muscles are tight. Lean back into your heels. Hey, what do the muscles in the back of your body do when you lean back like that? Squeeze your right leg and then release it. Left leg. Release it and look for feelings. Squeeze both legs and release them. Now abdominals all the way up to your heart and then let them go. What's that feel like? Pull them back to your spine and then let them go. What's it feel like? Pull them up to your heart and hold your abdominals in this time. Take a huge inhale. Use your elbows to find some stretch in your upper back and then flex your right arm as you exhale. Release. Flex your left arm. Release. Now both arms. Flex. Release. And what's it feel like? And then arms down to the side. Now arms over your head sideways, palms together. Reach up and then come down to your right until you feel a little bit of stretch in the left side of your body. Now this is important. Don't lean so far that you get tired and that you fight gravity. In this case, stand up tall enough to where you can hold this for a while because you're not leaning so far to fight gravity. Okay, that's important. Breathe easy, lean into your heels, and squeeze your left leg. Release, squeeze your right leg. Release, squeeze both legs. And just look for feelings. Now, abdominals, pull them all the way up. What's it feel like? Relax them. Pull them all the way back. Relax them. Pull them all the way up again and hold them in. Big inhale breath. As you exhale, squeeze your left arm. What do you feel in your shoulders? Release. Squeeze your right arm. What do you feel in your shoulders? Release the right arm. Now both arms. Squeeze and release. Come back up. Stop in the middle. Nice, easy breathing the whole time. Come down to your left. Push your hips to the right. Lean into your heels. Squeeze your right leg. And then release. Squeeze your left leg. Can you isolate the glute here? And release. Now both legs. Squeeze. If not, it's all right. Just send the signal. Pull your stomach up to your heart and release. Don't get tired, right? You're standing up tall enough that you're not fighting gravity. Pull your stomach back and release. Pull your stomach up. Hold your stomach in. Huge inhale so your ribs expand. And then exhale. Squeeze your right arm. And then release. Squeeze your left arm. Release. Now both arms. Squeeze and release. Come back up. Stop in the middle. Now drop your head back until you feel it in your throat. Reach your arms back for your chest. Push your hips forward. Take a breath here. Easy breathing throughout. What do your glute muscles do when you shift your body weight back into your heels? Now squeeze your right glute and then release it left and then release it. Now both. What's it feel like? Release them. Pull your stomach to your heart. Let go to your spine. Let go to your heart. Hold it in. Huge inhale. As you exhale, squeeze your left arm. What's that feel like in your shoulders? Release. Squeeze your right arm and release. Now both arms and change. Come back up. Pull your stomach in. Hold your stomach in and reach forward. No pain, just until you feel some nice stretches. Bend your right knee forward and your left hip backward to feel some nice stretches. So wherever you have to stop in order to keep the feelings nice, that's important. Maybe you're up here. Fine. We're not going for a distance. We're going for feelings here. Twist your left hip back. What's in the back of your left leg? Pull your stomach in again if you get tired and forget. Now switch your legs. Bend your left knee forward, right hip backward. Stomach in the whole time. What's in the back of your right leg? The glute, the kidney area, the hip, and then bend your right knee again so you're bending both of your knees. Stomach in the whole time. Grab your legs from behind, elbows behind your legs, and pull and stretch your head down. Again, we're not paying attention to what we look like in this pose. We're paying attention to what it feels like. Push your knees back until you feel your hamstrings. Pull with your arms until you feel your shoulders, and then squeeze your right thigh. And then release it. What's it feel like? Squeeze your left thigh. Release it. Now, both thighs. Squeeze all the way. Release all the way. Stomach. Pull it up to your spine. What's that feel like? Release it. Pull it forward to your heart. Release it. Pull it up to your spine. Hold your stomach in this time. Make a huge inhale. And then exhale. Squeeze your right arm. What's that feel like in your shoulders? Release. Left arm. Squeeze. Release. Both arms. Squeeze. Release. Nice, easy breathing the whole time. Pull your stomach in as you come back up. All right. Let's check. So we took the baseline measurement of the forward reach before. Let's compare. Suck your stomach in, reach forward, and now how far do you get before the muscles in the back of your body say, hey, that's enough? So just compare to the baseline that you took at the beginning. Pull your stomach in as you come back up. So just going through the body, finding little feelings actually makes the muscles act differently. So if this helps you, come and see us at backtoflexibility.com, and we'll do a longer class and get those nerves, the bones, and the joints and the muscles feeling great. All right, nice job.